Joint pain after 50 is not just normal aging anymore. It is often a sign that inflammation is quietly damaging your joints from the inside, day by day. The main problem many adults face is persistent joint stiffness, swelling, and pain in knees, hips, and hands that slowly reduces mobility and independence. The solution we will explore in this video focuses on reducing internal inflammation naturally through a simple daily habit, just 1 cup a day, that supports joint lubrication, lowers inflammatory markers, and helps restore comfortable movement over time. After age 50, this becomes dangerous because the cartilage that protects your joints begins to thin and the body produces fewer natural anti-inflammatory compounds. According to clinical observations in geriatric populations, more than half of adults over 60 report ongoing joint discomfort that affects daily activities like walking, climbing stairs, and even sleeping. What makes this worse is not just pain. It is the gradual loss of confidence, independence, and physical freedom that comes with it. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and memory concerns. In this video, I'll show you what's really happening with joint inflammation and the simple, practical steps that can truly make a difference. What most seniors do not realize is that joint pain is not only a wear and tear issue, but deeply connected to chronic inflammation in the body. And here is the critical part. This inflammation is often fueled by daily habits people think are harmless. In this video, I will break down a ranked list of foods and drinks that either worsen or improve joint health, and I will also reveal the #1 mistake most people make that quietly accelerates stiffness without them noticing. 1. Of the most surprising truths is that standard advice like only taking painkillers or resting the joints does not address the root biological cause, which is why discomfort often keeps returning. As we go deeper into joint pain after 50, it's important to understand that the problem is not simply old joints wearing out, but a slow biological process driven by inflammation, reduced cartilage repair, and changes in how the immune system behaves with age. Inside healthy joints, cartilage acts like a smooth protective cushion between bones, and synovial fluid works like a natural lubricant. But after the age of 50, the body begins producing fewer cartilage-repairing cells called chondrocytes, while at the same time, inflammatory chemicals known as cytokines gradually increase. This imbalance leads to a situation where the joint is not just aging, but actively being exposed to low-grade chronic inflammation. Clinical research in geriatric medicine shows that chronic inflammation markers such as C-reactive protein, CRP, tend to rise steadily with age, even in people who consider themselves healthy. Studies suggest that adults over 60 can have significantly higher baseline inflammation levels compared to younger adults, which directly correlates with increased joint stiffness and pain. Researchers also note that cartilage thickness can decrease progressively over time, especially in weight-bearing joints like knees and hips, making movement more difficult and painful. Another key factor is reduced synovial fluid quality. As we age, this fluid becomes less viscous and less effective at cushioning movement. That is why many seniors report a grinding or clicking sensation in their joints, especially in the morning or after long periods of rest. Geriatric specialists also emphasize that lifestyle factors, such as low physical activity, high processed food intake, and dehydration, can accelerate this process. Even individuals who follow general health advice like eat healthy and exercise may still experience worsening symptoms because the underlying inflammatory cycle is not fully addressed. This is why joint pain often becomes more persistent after 60. It is not just mechanical wear, it is a combination of biochemical inflammation, reduced repair capacity, and fluid imbalance inside the joints. And once this cycle starts, it tends to reinforce itself unless specific anti-inflammatory support is introduced through diet and daily habits. Before moving forward, I'll show you in the next section the most common mistakes people make that unknowingly worsen this inflammation and keep the pain cycle active instead of healing it. Many people try to manage joint pain for years, yet the discomfort keeps returning because they unknowingly follow habits that only mask symptoms instead of addressing inflammation at its source. One of the most common mistakes is relying only on painkillers or anti-inflammatory pills for long-term relief. While these medications can temporarily reduce pain signals, they do not repair cartilage or improve joint lubrication. In fact, long-term reliance can sometimes irritate the stomach lining and mask the warning signs your body is giving you, allowing the underlying inflammation to quietly progress. Another widespread misconception is complete rest and avoiding movement. Many seniors believe that, if it hurts, I should not move it, but this often leads to stiffness. When joints are not used regularly, synovial fluid circulation decreases and the cartilage receives less nourishment. Over time, this can make joints even tighter and more painful, especially in the morning or after sitting for long periods. A third mistake is focusing only on calcium supplements or general multivitamins. While bone health is important, joint pain is not only a calcium issue. It is primarily driven by inflammation and oxidative stress. Without addressing these deeper biological processes, supplements alone often show limited improvement. The key issue with these approaches is that they treat symptoms rather than the internal inflammatory environment causing the pain. They may provide short-term relief, but they do not reset the body's joint health system. However, emerging nutritional and clinical insights suggest something encouraging. Joint inflammation is not a fixed or irreversible condition in most cases. When the right anti-inflammatory compounds are consistently introduced into the daily routine, the body can begin to reduce inflammatory load, improve lubrication, and support gradual joint comfort. This is where the idea of a simple daily drink or targeted nutritional habit becomes important, because it works at the biological level instead of just covering up pain signals. In the next section, I will break down a ranked list of foods, drinks, and daily habits, from least effective to most powerful, that influence joint inflammation, stiffness, and long-term mobility. Now let's look at what actually influences joint inflammation in daily life. Not all foods and habits are equal. Some only give mild support, while others directly reduce inflammatory activity inside the joints and improve mobility over time. We'll start from the least effective and move toward the most impactful. Number 10 is over-the-counter pain relievers used regularly. These can temporarily reduce pain signals in the nervous system, making movement easier for a short time. However, their effect on actual joint inflammation is minimal, and long-term use can stress the digestive system. Verdict: useful for short-term relief, but not a real solution. Number 9 is simple hydration with plain water. Staying hydrated helps maintain synovial fluid volume, which supports joint lubrication. Even mild dehydration can increase stiffness. However, hydration alone does not significantly reduce inflammation. Verdict: essential foundation, but limited impact alone. Number 8 is gentle walking or light daily movement. This improves blood flow and helps distribute synovial fluid across the joints. Clinical observations show that regular low-impact movement can improve stiffness by around 10,015% over time. The limitation is that it does not directly reduce inflammation. Verdict: important for maintenance, not enough for reversal. Number 7 is omega-3 rich foods like fish. These help reduce inflammatory markers in the body and may improve joint comfort by up to 20% in some studies. However, results depend heavily on consistency and diet quality. Verdict: strong anti-inflammatory support but gradual effect. Number 6 is turmeric-based drinks or meals. Curcumin compounds in turmeric are known to reduce inflammatory pathways. Some studies suggest noticeable improvement in joint discomfort over several weeks. The downside is poor absorption unless combined with fats or black pepper. Verdict: powerful, but needs proper preparation. Number 5 is green tea. It contains antioxidants called polyphenols that help reduce oxidative stress in joints. Regular intake may modestly improve stiffness and swelling. Limitation: effects are mild and require long-term use. Verdict: supportive but not strong enough alone. Number 4 is weight management through balanced diet. Reducing excess body weight significantly lowers pressure on knees and hips. Even a small reduction in weight can improve joint load by 20–30%. However, it does not directly address inflammation chemistry. Verdict: very important mechanical relief factor. Number 3 is anti-inflammatory fruits like berries and cherries. These contain natural compounds that reduce oxidative stress and may improve recovery in inflamed tissues. Limitation: benefits are supportive rather than dramatic. Verdict: excellent daily addition. Number 2 is fermented foods like yogurt and kefir. These support gut health, which is increasingly linked to systemic inflammation levels. Research suggests a healthier gut microbiome can reduce inflammatory markers throughout the body. Verdict: strong internal support system for long-term joint health. And number 1 is a consistent daily anti-inflammatory drink strategy, such as a properly prepared warm blend of natural compounds that reduce inflammation, support circulation, and improve joint lubrication simultaneously. Unlike isolated foods, this works on multiple pathways at once, reducing inflammation, improving nutrient delivery, and supporting cartilage environment. When used consistently, it can create noticeable improvement in stiffness, especially in morning movement. Now that we understand the ranking, the next step is to focus on the top solutions and the exact daily action plan: what to take, how to prepare it, and how often it should be used for best results. Now let's focus on the most effective and practical solutions that actually make a difference in reducing joint inflammation and improving mobility after 50. These are not quick fixes, but consistent biological supports that help the body calm inflammation and restore smoother movement over time. The top 3 approaches consistently seen in nutrition and aging research are anti-inflammatory herbal drinks, omega-3 fatty nutrition support, and gentle daily joint activation routines. The third most effective is omega-3 rich intake from sources like fatty fish, walnuts, or flaxseed. Omega-3 fatty acids help reduce inflammatory signaling in the body by influencing prostaglandins and cytokines. Clinical studies suggest that regular intake can reduce joint stiffness and discomfort by up to 20–25% in some individuals over several weeks. The limitation is that results are gradual and require consistent dietary intake. Still, it is a foundational support for long-term joint health. The second most effective is daily low-impact movement combined with joint mobility exercises. This includes walking, stretching, and gentle range of motion activities. These movements stimulate synovial fluid circulation, which helps lubricate the joints naturally. Research in geriatric rehabilitation shows that even 15 to 20 minutes daily can significantly improve stiffness and functional mobility. The downside is that if inflammation is already high, movement alone may not fully resolve discomfort. Now, the number 1 most effective approach is a consistent daily anti-inflammatory drink taken once a day, ideally in the morning or early evening. This type of drink typically combines natural compounds such as turmeric, ginger, and warm water-based extracts that work together to reduce internal inflammation and support circulation. The reason it works better than isolated foods is because it targets multiple pathways at once: oxidative stress, inflammatory signaling, and fluid balance inside joints. A simple preparation example includes warm water mixed with a small amount of turmeric and ginger. The timing matters. Taking it consistently at the same time each day helps maintain steady anti-inflammatory activity in the body. Dosage should remain moderate. Typically 1 cup per day is enough for most adults. One harmless side effect some people may notice is mild warmth in the stomach due to increased circulation and digestive activity. A realistic caution is that individuals on blood-thinning medication should consult a healthcare provider before using concentrated turmeric regularly, as it may interact with clotting processes. What makes this approach powerful is not intensity, but consistency. Over time, it helps reduce the inflammatory burden that builds up in joints, allowing movement to feel smoother and less restricted. Now that we have covered the top solutions and how to apply them, I will move to the final section where we highlight critical mistakes to avoid and a simple 30-day challenge for improving independence and joint comfort. Finally, it's important to understand what can quietly undo progress when trying to improve joint health after 50, even when someone is doing many things right. One critical mistake is stopping all movement during pain flare-ups. While rest feels safe, complete inactivity can increase stiffness and reduce synovial fluid circulation, making joints feel even more locked over time. Another mistake is switching between too many supplements or remedies without consistency. Joint tissues respond slowly, and frequent changes prevent the body from adapting to any one supportive routine. A third mistake is ignoring early morning stiffness and assuming it is just aging. In reality, this is often a sign of ongoing low-grade inflammation that needs daily management, not occasional attention. And most importantly, many people still believe joint decline is inevitable. In reality, much of this process is influenced by inflammation load, nutrition quality, and movement patterns, not just age itself. When we reframe joint pain as a biological imbalance rather than permanent damage, the focus shifts from limitation to management and gradual improvement. A simple 30-day challenge can begin here. One daily anti-inflammatory drink, light daily movement, and consistent hydration. The goal is not perfection, but to reduce stiffness, improve comfort, and rebuild confidence in movement step by step.